Sexual impotence, also known as erectile dysfunction, is a condition in which a man has difficulty getting or maintaining an erection during sexual activity. This condition can affect men of all ages, but it is more common in men over 40. The causes of sexual impotence can be varied. Some physical causes include health problems such as diabetes, cardiovascular disease, high blood pressure, neurological diseases, prostate problems, use of certain medications, among others. In addition, smoking, alcoholism, drug use and obesity can also increase the risk of sexual impotence. Other causes of sexual impotence are psychological in nature. Stress, anxiety, depression, low self-esteem, relationship problems, among others, can lead to erectile dysfunction. It is important to remember that sexual impotence can often have both physical and psychological causes. Symptoms of sexual impotence include difficulty getting or maintaining an erection during sexual activity, lack of sexual interest or desire, and premature or delayed ejaculation. Sexual impotence can significantly affect a man's sexual and emotional life, causing stress, anxiety, low self-esteem and relationship problems. Fortunately, sexual impotence can be treated in several ways. Treatment will depend on the cause of the erectile dysfunction. In cases of physical causes, treatment may involve lifestyle changes, such as a healthy diet and exercise, or treatment for underlying conditions. In some cases, medications prescribed by your doctor, such as phosphodiesterase type 5, PDE5, inhibitors, can help improve your erection. Treatment for psychologically caused impotence may involve sex counseling or therapy to help identify and treat the psychological factors that contribute to erectile dysfunction. In some cases, it may be helpful to involve the partner in the treatment. In addition, there are other treatment options for sexual impotence such as penile injections, vacuum devices or penile implant surgery. It is important to remember that treatment for sexual impotence must be guided by a specialist doctor. In summary, sexual impotence is a common condition that affects many men at some point in their lives. The causes can be varied, including physical and psychological factors. Fortunately, there are many treatment options available to help men overcome sexual impotence and improve your sexual and emotional quality of life. It is important to seek medical help if you are experiencing persistent or frequent erection problems. Furthermore, it is important to remember that sexual impotence should not be a reason for shame or stigma. It is a common and treatable medical condition, and many men can benefit from treatment. Open communication with your partner can also be beneficial, as impotence can have a significant impact on your relationship. Some men may feel that impotence is a sign of weakness or lack of masculinity, but it's important to remember that this is not true. Impotence is a medical condition that can affect anyone, regardless of their gender identity or sexual orientation. Also, it's important to remember that sexual impotence is not a sign of inevitable aging. Although sexual impotence may be more common in older men, many older men still have normal, healthy erections. Aging can increase the risk of underlying conditions that can cause impotence, but many of these issues can be prevented or managed with a healthy lifestyle and proper medical care. To prevent sexual impotence, it is important to maintain a healthy lifestyle, with a balanced diet, regular physical activity, avoiding smoking and excessive consumption of alcohol and drugs. In addition, it is important to have regular medical checkups to detect and treat early health problems that may contribute to sexual impotence. In summary, sexual impotence is a common medical condition that can affect men's sexual and emotional quality of life. The causes can be varied, including both physical and psychological factors, but there are many treatment options available. It is important to seek medical help if you are experiencing frequent or persistent erection problems, and remember that sexual impotence is not a sign of weakness or lack of masculinity. With a healthy lifestyle and proper medical care, it is possible to prevent or manage many of the problems that can lead to impotence. When it comes to impotence treatment, there are several options available. Some of the options include lifestyle changes, psychological therapy, prescription drugs, penile injections, vacuum devices and surgery. Lifestyle changes include regular exercise, a healthy balanced diet, losing weight if necessary, stopping smoking and reducing alcohol consumption. Also, reducing stress and anxiety can help improve sexual impotence in some men. Psychological therapy can be beneficial for men who are experiencing impotence issues due to emotional or psychological issues such as depression, anxiety or stress related to sexual performance. Prescription drugs such as sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra, are popular options for treating impotence. These medications help relax the muscles around the blood vessels in the penis, increasing blood flow and helping to maintain an erection. It is important to remember that these medications should only be taken under medical supervision, as they can interact with other medications and have side effects. Penile injections are another treatment option for impotence. These injections contain medications that help increase blood flow to the penis, which can lead to stronger, longer-lasting erections. Vacuum devices can also be used to help get and keep an erection. These devices work by placing a plastic tube over the penis and creating a vacuum, which helps increase blood flow and achieve an erection. Surgery may be an option for men who do not respond to other forms of treatment. One of the options is the placement of penile implants, which are surgical devices that are placed inside the penis to help obtain and maintain an erection. It's important to remember that sexual impotence doesn't have to be an obstacle to a satisfying sex life. There are many treatment options available, and it's important to seek medical help if you're experiencing frequent or persistent erection problems. With proper treatment, many men can overcome sexual impotence and improve their sexual and emotional quality of life.